Amid a flurry of system failures, the president has taken to the road to build support for his healthcare law. Each day, the chief executive will outline one success of the program, leading up to a December 23rd deadline to get coverage in January. Many observers close to the debate over the law believe providing lower prices would have been better provided by a free market system. Some healthcare providers are supplying services at lower prices by offering procedures in exchange for immediate payment. One of these facilities is the Surgery Center of Oklahoma. This healthcare provider is collectively owned by approximately 40 local surgeons. Payment plans are not available through the Center for Outpatient Surgery, but they are a state-of-the-art medical institution with infection rates much lower than the national average. The medical director of the Surgery Center of Oklahoma is Dr. Keith Smith. He's a board-certified anesthesiologist with over 2 decades experience in private practice. He's also an author who has written extensively on the effects of Obamacare. Dr. Smith is our guest on the show today. He's here to talk to us about challenges to the president on implementing his health care law. We'll discuss some of the causes of the failures as well as what can be done to repair the system. The effect of the law on both applicants and healthcare providers will also be explored, and we'll talk about the president's new publicity tour supporting his reforms and more. Welcome to the show, Dr. Smith.
Thank you. Thanks for having me.
Doctor, how badly was the system in need of repair before Obamacare took effect?
It was a disaster. I've never been a defender of the current healthcare system because there's little or no free market in it at all. The government became very heavy-handed in the late 50s and the early 60s, and then extremely heavy-handed in the 70s and 90s. So it's become cartelized. There's really the usual crony suspects in the corporate healthcare, and I see Obamacare as just an extension of that, a way for them for the usual players, I mean the big insurance companies and the hospitals, to basically have guaranteed revenue from the taxpayers, where they don't have to face willing consumers. They have guaranteed revenue. So it's a crony capitalism sort of setup, and Obamacare is just really an extension of that.
What do you think should have been done to fix healthcare if the president's plan presented such challenges?
I think individuals left to their own devices seek out mutually beneficial arrangements. That's certainly the hallmark of the patient-doctor relationship. So anytime the government gets involved with their various fines and penalties for non-compliance, that just represents an interference in what people would normally do as individuals between themselves. So anything that the government has done, anything that they've done in regard to healthcare is a disaster and interferes with what people normally would do if acting mutually beneficial. And it's always with the idea that some party is going to benefit disproportionately from it. And in the case of U.S. healthcare, it's the corporate healthcare cronies.
Now, what do you believe some of the biggest challenges for the president has been in implementing this insurance program, the Affordable Care Act?
Well, government never gets anything right, so this is just another example of that. I've wondered, though, if all of this was meant to crash and meant to fail, so we'll have even more chaos in an already dysfunctional system, and beg Uncle Sam to write in with the relief, which is the sequel, single payer, and the guys in Washington made no secret that that's what they wanted all along. But implementation of a program like this, I don't know. They've made it look harder than it should have been. But once again, I wonder if the whole intent all along was for this to crash and burn, so that what could emerge from the ashes is what they wanted all along.
Well, America witnessed the crashing and burning of the website, healthcare.gov, policy cancellations nationwide for average Americans. Going into the Obamacare coverage, what problems do you foresee average Americans enduring when trying to obtain health insurance coverage from the government?
The latest article I read is that as many as 129 million people who are covered now will lose their coverage, and of course, rendering everyone uninsured it would be the obvious next step to having single payer. But to not have insurance is going to be very scary for a lot of people. But I've said from the beginning that I think very, very unintentionally, the single planners are going to create a consumer market, because as the price of insurance goes up and the premiums go up, people will increase their deductibles to try to make their insurance affordable. And that means more of what they spend for healthcare will be coming out of their pocket. And people spending their own money ask the same question. They want to know how much is it, and they want to know up front. That's a very deflationary question. So in spite of all of the attempts of the federal government to either destroy or manage healthcare, and all the fear and all of the chaos that's going to result, I'm very optimistic that what will emerge will finally be a consumer market where healthcare is affordable and people will think more about buying healthcare than health coverage.
Well, speaking of healthcare, how are the president's healthcare measures affecting healthcare providers specifically?
Well, a lot of the physicians that are in a position to retire are quitting. I know some polls have showed that as many as 70% of currently practicing physicians are ready to hang it up. So a lot of physicians are quitting. A lot of physicians are walking away from third-party payers altogether. So they're just saying, I'm not going to take insurance, I'm not going to take Medicare, I'm not going to take Medicaid. If you've got a problem, you come on in, but leave your insurance card in the car.
What type of strings are attached for healthcare providers that do accept Obamacare or Medicare or Medicaid?
Well, I've said that Medicare is the only insurance company that has its own F-16s and tanks, and that's not a coincidence. There are doctors that are in jail that have made simple mistakes on Medicare claim forms. So the full force and power of the federal government is behind these programs, and just simple errors that could be interpreted as upcoding, unbundling, things like that. It could result in audits, what are called RAC audits of facilities or physicians. It's just bankrupting for the facilities and physicians that go through that. So, yeah, there are horrible strings attached, not to mention that to take that money means you're inviting that bureaucrat into the exam room where there's some control over the type of care that is rendered. And then, of course, all those patients' medical records are basically the property of the federal government, and there aren't any more secrets.
Doctor, are death panels a real threat?
Yes, and there are really overt clauses in the bill that refer to that sort of activity, and then there are sneaky ones. The sneakiest death panels come in the form of the language of the Independent Payment Advisory Board and the payment for performance. And to break those down quickly, the Independent Payment Advisory Board is anything but independent, but their job will be to find that price below which any doctor will be willing to work. So if you have price controls, you have shortages. So all they'll have to do is price the care of, say, renal failure patients or patients with congestive heart failure. They'll just price that care below that at which any physician would be willing to see those patients. And then those patients suddenly have no care. That's very cruel, but that is the purpose of the Independent Payment Advisory Board. The other one is payment for performance. And that sounds great. We're going to reward people and pay them more if they provide better care. What that really means is that the poor patient who has kidney disease, lung disease, heart disease that needs a hernia operation is never going to see the inside of a physician's office because that doctor is going to be marked. They're going to be profiled for how well that patient does after surgery. And people like that oftentimes have many, many more complications. So they're simply not going to get through the door. And that's the whole purpose of this language. It's just Orwellian. It's just very, very scary.
Doctor, I want to talk about the effect of Obamacare on employers. I also want to discuss your practice specifically, but we do need to take a break. Stay tuned for more. We're talking with Dr. Keith Smith right here on WHDT World News.